Hello and welcome to EUFOREA TV Breaking News. My name is Dr. David Bull. I'm a medical journalist and I'm delighted to be your host for this, our first show of February 2021. Now, this show is all about the Galenus Health Platform. In a minute, I'll be talking to Professor Martin Wagnerman from Düsseldorf University Hospital in Germany. I'll be asking him to talk us through the Galenus Health Platform, and I'll be asking why he thinks it's beneficial for doctors and for patients alike in Germany. I'll also be getting a view from London, talking to Dr. Simon Gain from the Royal National Throat, Nose and Ear Hospital. The Galenus Health Platform is named after the famous physician Galen, or Claudius Galenus, who occupies a very important place in the history of Western medicine because in the 2nd century AD he developed a groundbreaking medical system. And Galenus Health is an international implementation and digital technology organisation. It aims to provide digital solutions for patients, general practitioners, specialists, pharmacists and patient organisations through all phases of chronic respiratory diseases like asthma, chronic sinus disease and respiratory allergies. Its core mission is to ensure that the right patient gets the right information and the right therapeutic plan at the right time of the disease, all with the aim of reducing disease burden and achieving cost savings for society. So, to tell us more about Galenus Health, I'm delighted to be joined by Professor Martin Wagnerman, Head of Rhinology, Allergy and Endoscopic Skull-Base Surgery at Düsseldorf University Hospital in Germany. Martin, it is very good of you to join us. I've given a sort of very brief overview of the platform, but could you expand on it and can you explain exactly what the platform is and how it works?
Yes, of course, and thank you for listening to me for this. Well, actually, as you said, on the surface, the Galenus system is a modern e-health app and a physician dashboard. But behind that, it's actually an integrated system for patients with, as you said, chronic respiratory diseases, the most important ones for us being allergic rhinitis, chronic rhinosinusitis, asthma. And it's not also only for the patients, but it's also important for the doctors and, in general terms, the healthcare providers. What it does actually, it allows the patients in a convenient way to enter information on their disease, on their symptoms into the app. But not only that, but also other relevant information like their medications, their visits to doctors, and other important systems. And on top of that, it also adds a lot of information on the diseases themselves for the patients. And these are really excellently displayed and patients can access them easily. So that's very, very helpful. In general terms, it's a tool that allows us to give us, let's say, an overview on the longitudinal course of the disease and the patient, their journey and their life with the disease. And that is by itself extremely helpful and it, of course, is integrated into a whole system.
Well, it sounds like you're very excited about the platform, and I assume, therefore, you're proactively supporting the implementation of it in the Düsseldorf area. Would that be right?
Yes, that's exactly right, and that's what we've been doing for the last months and weeks, and especially in this situation now in the COVID pandemic, it has proven to be extremely helpful and valuable because it allows us to see information about the course of our patients without them actually being physically present in our department. And the other thing that is extremely helpful for us, I mean, just imagine a typical situation where you ask a patient as a doctor, how did you feel the last 2 weeks? Well, if I were to ask you, how did you feel last Thursday? Usually you don't remember that. But if you have the data and the lines, that is so helpful and easy to access this information. And so on a clinical side, it is extremely helpful. But on top of that, it also enables us to improve the collaboration between doctors, between different disciplines. And also, it can be potentially an extremely helpful research tool as well, because it allows us to continuously observe the course of the disease of not only individual patients, but a group of patients.
Well, you very eloquently have outlined the benefits for your colleagues in Germany. What do your patients think about it? Are they big fans of the platform?
Well, actually, many of them are. I mean, it's relatively easy. Of course, it depends on your patients. You know, it needs to be a patient who doesn't have a barrier to using usually his or her smartphone. But for most of these patients, once you explain to them, it's very easy. We actually generated flyers explaining to them. They have a QR code where the patients can download the app for their smartphones, and that's a very easy process. And then the patient is actually asked if he or she agrees to share their data with us. And that, of course, is the second very important step.
Well, obviously, you know, implementation is an ongoing process, as you say. Have you been pleasantly surprised by the results that you've seen?
Yes, I mean, this is really, I mean, you know, especially what we see our side is the physician dashboard. And this is really easy to use and to get, at the same time, to get very granular and relevant information out of that. And so the ease of use is really extremely important. Of course, there are always some issues that need to be worked on, how to integrate that in your clinical workflow, how to integrate that in the other clinical systems that you use in your individual department. But as a whole, I really think this is extremely interesting and will be extremely helpful in the future for us, for our patients, and also for the system in general.
Well, it sounds very exciting. It sounds like it will revolutionise patient care. So thank you very much indeed, Professor Wagnerman.
Thank you. It was a pleasure.
Well, there you are, some really fascinating insights and opinion there from Germany. So now let's move across the channel to the UK and get a view from London. So joining me now is Dr. Simon Gain. He is consultant rhinologist and ENT surgeon at the Royal National Throat, Nose and Ear Hospital and Moorfields Eye Hospital, both in London. Simon, thank you very much indeed for taking the time to join me. Let me start by asking you, I suppose, a simple question. What do you think of the Galenus Health Platform?
It's a very exciting start to, I think, where the future of healthcare is going to develop too. I think that these kind of patient-centered, patient monitoring, long-term what I call background information gathering platforms are really going to transform the way that we think about the impact of disease and the impact of treatment. I think the Galenus platform is elegant, simple, easy to use, and probably one of the best in class that I've seen.
Well, it sounds like you're a huge advocate there. So tell me, have you implemented it in your own hospital? And if you have, why did you do that? Why did you come to that decision?
We haven't implemented it fully in our own hospital at the moment, although I do have some patients who are using it because you can just download the app and they find that useful. We are having some discussion still about integrating it with our own EMRS, the electronic patient record service that we have at the moment, because I think it's very important that that this integration goes forward, because we want this information not only for the patients but also for all their caregivers, and that's really been where we're sticking at the moment.
Well, you mentioned there the patients and of course the caregivers. So how is the platform perceived currently by your colleagues and more importantly actually by patients in London, the patients that you've mentioned? Because the app is actually relatively easy to download and it seems pretty user-friendly.
I agree. I think it is user-friendly. I think it's very beautiful, actually. It's very well developed, and a lot of attention has been placed on its appearance and usability. And I think that's key to acceptance by our patients.
So if you do look into your crystal ball, you mentioned biologics there, how do you think the Galenus Health then will evolve and develop? So what does it need to do to keep up to date, to keep relevant? I assume you sort of need two-way transmission of patient data back, clinician input and so on. It needs to constantly evolve, doesn't it?
Yeah, I think and this is something that I've been saying from the beginning, I think it's ease of use that's really the key for both patient and clinician uptake. it needs to be capturing data passively. And obviously there are concerns around that and around privacy and things like that. But the more data that you capture with the less input that you need, so if we have a way of finding relevant data from our patients without needing them to open the app and input things every day, then that's going to give us a much more powerful picture from a patient point of view. And then the same from the clinician point of view. If that data is there when we open, and this is part of our negotiations in my hospital, if that data is there, that it pops up when we see the patient, we can see, okay, these are their exacerbations, this is their timeline, this is what they're worrying about. That gives us much more data to work with and to make treatment adjustments, treatment decisions, decide to go for surgery. I think it's going to be really important because we're going to need quality-adjusted life year calculations to get these things paid for by our healthcare system at the moment. In the UK, the majority of our healthcare is delivered by the National Health Service, and we have a body which very strictly controls what we can spend national health budget on based on its impact on quality of life and life year adjustment. So if we're capturing this data and showing, look, these things really make a difference, this person is really severe, and we can sort of correlate the impact with these expensive drugs with a vast improvement in their quality of life.
Well, I wish you the best of luck with implementing it in your hospital. Thank you so much indeed for your time, and thank you for talking to me. That's Dr. Gain.
Thank you very much for inviting me on.
Well, it's really fascinating to hear about the Galenus Health Platform and how it's being used across Europe to improve the quality of patient care and at the same time empowering clinicians. Well, that's it for this edition. Many thanks to my guest, to Professor Wagnerman and to Dr. Gain for being so engaging and informative. Now, don't forget, you can find more information about EUFOREA, and you can also register for the EUFOREA meetings on the EUFOREA.eu website, where you can also sign up to receive the latest news via email. You can also follow us on Twitter. The address is @EUFOREA. But that's it for this show. See you soon, and thank you for watching.